I'm Dr. Larry Santora.
I'm Heidi Cortese.
Welcome to Health Matters. Thanks for joining us today on Health Matters here at Chapman University. We're going to take the mystery out of medicine and give you the straight facts. Today we'll talk with Dr. Jack Chen about the latest advances in treating back pain.
You've probably heard Rex Hudler's witty play-by-play announcing Angels baseball. We've hit a home run today because Rex will be on our show to talk about his grand slam work in support of the Down syndrome community. And there's a vaccine for shingles. But do you need to get it? Larry will explain exactly what you need to know about preventing a painful eruption of this virus.
Our first guest is Dr. Jack Chen, who specializes in the treatment of spinal disorders in both adults and children. His practice is in the city of Orange at the Orthopedic Specialty Institute, and he's here to talk about the latest treatments for back pain, which affects about 80% of the people in the United States. Jack, thanks for coming on Health Matters.
Thank you for having me.
You know, this is a big problem. Like, everybody has back pain, sure, it seems. And when do we know to see a doctor? When should a patient see an orthopedic doctor, a GP? Can you give us a little guideline on that?
Larry, as you might have mentioned in your introduction, back pain is one of the most common disorders that we are afflicted with. Believe it or not, is actually the second most common reason that people call in sick to work. Really, right next to the common cold. So just because someone has a day or two of severe back pain doesn't necessarily mean you should run to your doctor right away. Okay, we have a lot of muscles in our back, and they're prone to sprains and strains, and so that's most likely the cause of severe back pain.
What would be the warning sign? Well, hey, I need to see a doctor right away.
Well, sometimes back pain can radiate into the legs, and that's one thing that should alert a patient to be a little more concerned. It's also a sign that throws up a red flag for me, because usually if someone has leg pain in addition to their back pain, it may mean that there's some nerve compression. Mm-hmm. As you know, that our back is made up of a network of nerves. It conducts signals from our brain down to our legs, and if there's something pushing on those nerves that go to our legs, you're going to feel leg pain. Excuse me.
What can be done to alleviate that nerve compression in the back?
The most obvious answer to that is sure, there are surgical options to alleviate that nerve compression. But even before we discuss surgery with any of the patients that come to the office, we want to try as many and exhaust all the conservative treatment options that we can first before we talk about surgery. And that may mean options such as epidural injection or physical therapy to relieve the symptoms of that nerve compression.
So epidural injections, you're actually putting some anesthetic right into the spinal
canal, yes, the space for the nerves. When the nerves are compressed, they become inflamed, and inflammation causes pain. So an injection, such as what Larry mentioned, is a combination of anesthetic medicine, just like the same type of medications that you get at the dentist to numb up your teeth, combined with some steroids. And steroids are the best anti-inflammatories that we have. What does then, if it calms down the inflammation from that nerve compression, it takes away the pain. And once you don't have any pain anymore, that crowding of the nerves really essentially becomes asymptomatic, or you don't feel it.
How often can you get an epidural? I mean, is there a limitation? I mean, once every month?
I tell patients you can really have as many epidurals as you want. If we're talking about treatment of leg pain, an epidural is a treatment option that has been shown in a lot of our literature to help patients prevent surgery. But of course, you know, I think an accepted standard of practice is really to have no more than 3 epidurals within a span of perhaps 2 to 3 months.
Now, the most common one that I've heard is a laminectomy. Is that still a common procedure? And exactly what is it?
A laminectomy really is a surgery that we do to open up the space to the nerves. If you can think about it, our nerves run in a tube, which is the spinal canal. Okay, I always tell patients in the office, think of it as a snake inside of a pipe. And the snake is your spinal cord or your nerves, and the pipe is the space for the nerves. As we get older, we develop bone spurs, or if we get a herniated disc, which is another common thing that you hear. But these disorders, and I can explain that later if we have some more time, but the concept that I want you to understand is that the tube that the snake is in becomes crowded. Okay? So a laminectomy is a simple surgery where we unroof that tube. So sort of making that tube into a U shape, almost like a half pipe, but we take the roof off of that tube, and so the space, the nerves now, where that snake has really limitless room to expand and be free. So that very reliably relieves the patient's leg pain.
I see you've brought some models here on our show.
Right.
Could you please tell us what they're all about?
These are some of the newer devices that have been recently either approved by the FDA or have really gained a lot of popularity in the recent years. I think here to our left here is a model of a disc replacement in the neck. Just as I alluded to, we do fusions in the neck commonly after a decompression procedure. I'll give you a common patient scenario so you can relate. Someone comes in with arm pain and it's due to a disc or the cushion in between the bones. This is an acrylic model of two bones, and you can see in between the two bones here you have a metal device. Now, naturally, we have cartilage and ligaments which form a cushion in between the two bones. This cushion can break down and push back toward the nerves. If it pushes on the nerves of the arm, you'll get arm pain. So to treat this arm pain, what we can do is to take away the whole disc. And like I had said, when you take away the whole disc, you have to fill the space in between the two bones with something. And the traditional treatment is a fusion, which immobilizes these two bones in relation to another. Well, a recent advance has been the fact that we're now able to place a prosthesis, or really two metal pieces that articulate together, very much like a knee replacement or a hip replacement, and that maintains the motion in between the two bones instead of fusing the two bones together.
So they're rigid. So these are, you have mobility and flexibility.
Right. Here. After our discectomy, where we've already removed the disc, and the preliminary FDA studies, or the studies that we've done comparing patients who are treated with this versus patients who are treated with a traditional fusion, have been very promising.
So this is much more important up in the neck. We need that extra mobility compared to the back, where it's not as
compared to the back. I think
lower back.
Yes, in the low back, there are also a disc replacement which was approved by the FDA several years ago. The lumbar disc replacement is not as commonly indicated, but that is also a treatment for back pain, which we began to talk about at the beginning of the show. Again, there's very specific indications for it.
That's very exciting. And what is the other device that you have?
Well, this is a model of, you can see again, here's an acrylic model of a spine bone, okay, or a block of bone. You understand in our spine, our spinal column is made up of a bunch of bones stacked together, very much as a child stacks a stack of blocks. Our spine is made up of bones stacked up on each other. As we get older and our bones get softer, a very common entity that we see is osteoporosis, which is softening the bone. With the osteoporosis, patients can also have fractures of the bone. And obviously, you would infer, again, that when someone breaks their back, it hurts a lot. It causes a lot of pain. So a treatment that we can do to stabilize the pain from the fracture is to inject cement inside. And you can see these two white pellets of cement that have been injected into the bone. What that does is it stabilizes the fractured pieces together and holds it together so it doesn't hurt as much. Very, very much in the same way that we are able to put a cast on a broken arm to keep those two broken pieces of bone together so it doesn't move so much and cause pain. Now we're able to put an internal cast inside the bone to treat someone's back pain from a fracture.
Now, is that relatively new, that treatment there?
Yes, it has gained popularity within the last 5 years. 10 years ago, doctors didn't have this sort of an option to treat someone's pain from an osteoporotic fracture.
So there's a whole lot more surgical options now than there were just a few years ago.
Yeah, there are some, but again, I want to make sure that that you understand and the audience understands that prior to surgery, we really try to, again, look at all the other conservative options, treatment options that we can before we move ahead with any of these treatment options that I've shown you today.
We have time for one more question. What would be the #1 thing all of us can do to improve overall back health?
Well, I think a regular exercise would be good, and also good trunk strength, good core strength.
Good core strength.
Something that you would learn from a physical therapist if that's something that you need some help with.
Thanks so much for coming on Health Matters. That was really informative, and it's a whole new world because I know I'm going to need one of these soon. Thanks so much for coming, Jack.
You're welcome.
Thank you, Dr.
You're welcome.
Chen.
It was a pleasure.
Fact Or fiction. Giving a child sugar will cause hyperactivity.
Fiction. In a normal child, there is no direct link between sugar and behavior. Even so, it makes sense to limit sugar in children because it can lead to obesity, cavities, and a loss of appetite for healthier foods.
Our next guest, Rex Hudler, as you know, is a broadcaster for Angels Baseball. He was a professional ball player for 21 years and played for 7 teams, including our very own Los Angeles Angels of Anaheim. He has a career record of 56 home runs.
In 1996, Rex's first son was born with Down syndrome. He and his wife Jennifer founded a nonprofit organization called Team Up for Down Syndrome, which helps improve the lives of those living with this disorder. Rex, thanks for coming on Health Matters.
Thank you. I'm thrilled to be here with you beautiful people.
At least one beautiful person. I mean, you've had a fantastic career. I mean, you're an announcer, a professional ball player. You have a World Series ring, and you've had this wonderful organization for Down syndrome. Can you tell us a little bit about Down syndrome, what it is? And I'm not sure everybody's aware of it like you are.
Sure, Doctor. I'm thrilled, first of all, to be here and have an opportunity to be able to share with other families and people that might know a little bit of something about a Down syndrome person, or like I like to call it, up syndrome. Nothing, nothing derogatory about the name Down, but I like up.
Up is better.
Yeah, you know, Down syndrome, it's a chromosomal disorder. It's caused by an error in the cell division that results in the presence of an additional 3rd chromosome. They call that 21 trisomy. This presence can lead to recognizable physical traits and a limited intellectual endowment. While some may think that this can impede their lives, where it's impossible to predict their future. While some may think that people with Down syndrome are not going to amount to anything in life, that's totally false. Their dreams, their skills, they can all be reached given the opportunity and given the proper enthusiasm and the proper love. They can reach their full potential, and that's our goal.
So with your foundation, what are the goals of your foundation? You give awareness to the public, or do you have fundraising? What exactly do you do?
Yeah, we love to share my son, Cade, as well as my other 3 children. We like to share them with the community. And being a broadcaster under the umbrella of that with the Angels and a great organization, it's fun to be able to be out in the limelight where I have an opportunity to share and go places. We want to raise awareness. That's the main thing, really. Raise awareness to the contributions that children can make and adults in our society. And also, we have a fundraiser that we do each year, once a year. It's in July. It's around the All-Star Game, and actually it is the night of the All-Star Game. We call it the All-Star Party at Angel Stadium. And people come and we celebrate the lives of individuals with Down syndrome. Young, more mature folks with up syndrome are there. We also, you know, we raise the funds for the community, for the Down syndrome community. You know, housing, health, education, job training, family counseling, those type of things and other worthwhile causes that are all involved in the Down syndrome community need help. And what we can do to raise funds, we raise the funds and we allocate the funds to keep these organizations up and going. And that's our main goal, really, is to raise awareness and share them, share our family and share people like that, because there's no shame in that. Yeah. It's beautiful. They're beautiful people. They're up. They're happy. They're unconditional lovers, and that's what makes our world a better place.
Absolutely. What are some of the personal touches that you and your wife provide for, say, moms and dads out there who might need a little more emotional support?
Well, you know, there are certain things that we do hands-on in the community. As a matter of fact, my wife, she teaches music, a music program at Peters Canyon Elementary School in Tustin. And she is there hands-on so she can be near her son, Cade, our son. But she's given back by teaching them music. She does little things like that. For me, I like to encourage dads. Dads are kind of get left out. Yeah. You know, moms are really the hands-on people, the persons that work with their kids all the time, and dads go do their job and stuff. But really, we're charged of not being emotional and not really caring, but we do care. And there's a lot of things that I can do to help a man or a father get adjusted to having his child. And you know, I like to give my number to different organizations that any young dads that are expecting a child with Down syndrome to come into their life, that's always a tough time.
Sure.
And so I like to be able to encourage dads encourage them about the positive things that can happen. And sure, it's a tough adjustment early, and everyone has to go through that. They're in their own way, but encouragement's the main thing my wife and I like to do.
Did you have resources available to you when Cade was born, or did you have to find your way alone?
You know what? The doctor that we had for my wife, he was very instrumental in guiding us to the right direction. ICEC is our early intervention for young people, young kids. It's an organization that helps the families come together. The babies are all there. And there's like 7 or 8 volunteers, ladies that help out and help with their motion and doing little things with their hands and arms. So early intervention is really helpful. As far as that goes, somebody from the city came over from the government. They come over and they want to take an assessment and they want to look at your child and stuff. But really, you have to seek. You have to go out and search. I remember when they called me. And we had taken Cade home. We had him home for 2 or 3 days. We weren't sure something was up, but the doctor had pronounced him healthy. I mean, typically healthy, and a good-looking boy, and congratulations. But he wasn't nursing properly, so we thought something could be wrong.
Sure.
So they took a blood test from him, and we took him home under a cloud of suspicion, which was very difficult. To take your baby home and not know there's a diagnosis was really tough. But then they called me 3 days later and said, hey, your son has tested positive for Down syndrome. So I was like,
Oof.
Oh, really? Is there an owner's manual you can give me for that? Or what are you telling me exactly? What do I do now?
Right.
So I craved, I wanted to talk to other parents that had kids with Down syndrome. I really want, so the ICEC, this group, got us together, and the parents would all go in another room, and we'd sit around a table, and we would talk about the differences that each one of us had. Wow, yeah. But it helped me so much.
Imagine.
And I was an active baseball player for the Angels when we had him. I just come off my best season ever.
Oh.
And so here these other men are sitting around this table looking at me thinking, gosh, there's this big league ball player here, but really it doesn't discriminate. Right. Okay, birth defects and disabilities happen to all of us. And it's up to us to accept that and move on in a positive direction to help our kids reach their full potential. But it was a shocker. But there's things you have to search out and reach out and look and be proactive in trying to find some help for you and your family and your children.
Now, does Cade go to the ballpark with you? Does he like baseball?
Oh, what a question. In our particular situation, guys, we're really blessed. Cade has he's on the autistic spectrum as well, so we're doubly blessed, so to speak. So what comes with the autistic is the sensory issues. And noises at the ballparks, the fireworks that go off and all that can be tough. But Cade now has been coming to the games for 9 years, and he's getting to where he goes in the stands. He does not holding his ears all the time.
He's bringing that rally.
Yeah, and he's got his pom-pom out there, and he loves baseball. And it's neat to see how he's evolved as far as coming to the ballpark, which typical kids have a hard time with the noises in a ballpark. But especially if your child has a disability, sometimes that can be magnified. But he's gotten through that. He's enjoying it with my other children. They go, and they love Angels baseball just like their daddy.
That is absolutely wonderful. Now, do you have a special day for special children at the ballpark? Has anybody been working on coming up with?
Absolutely.
Oh, we do?
Yes, we do. We have a buddy walk at the ballpark in November when the season's over.
Oh,
with the families, we all go out there and we walk around the ballpark, and then we invade Angel Stadium. Yeah, and that's through the DSAOC. The organization here, that's a Down syndrome organization in Orange County. And we have a buddy walk. We had like 3,000-4,000 people last year and their kids. And it's a celebration. It's a big party right there on the field. Okay, we do that after the season's over. But also, there are certain things that we'll do off the field, like the Challenger Little Leagues, that are around the community here. Challengers is for kids with all kinds of disabilities that play baseball. They like to play just like typical kids like to play, but they all play together, so the competition is not the same. It's more about the true love of the game of baseball. So there's a lot of different things that we do. Of course, being a father of 4 and trying to be a good husband as well, and being on the road with the Angels a lot is very challenging time-wise.
I bet.
We're willing to give and help out, and basically whenever we have time for, without neglecting our own family.
Well, we have time for just one more question or one final thought here. What is the biggest piece of advice that you can give to parents who do have a child with Down syndrome?
Well, it just depends on what stage you're in. I'm in year 11. My wife and I are. My family's in year 11. It's gotten much easier. Cade's learning and developing along the same lines as some of my other children are, just a little bit slower. They get there, but it takes them a little bit longer. I think that the key for a dad or a mom out there is to seek other parents. Go out and look for other parents. There's websites out there. There's parents that would love to share about their child that's 2, 3 years older than yours, or even if you have a newborn. If you've got a newborn, you know, you kind of get through that grieving process of grieving the dreams that you had of your typical child, and you just have to change those dreams around. And you have to change your dreams to the child that you're expecting. And I remember it took my wife and I, you know, a little bit of time before we could kind of come to grips with it. But then I remember God put on my heart, hey, I gave you a gift, and you're insulting me by being a little bit apprehensive about the gift. How do you accept a gift? You stick your hands out, Hud, and you accept your gift I gave you and say thank you. That kid is going to be a big light in your life. You don't see it right now, but he's going to bless your life and everybody around it. And Hud, I'm going to give you a good job that you can share him with everybody else. So he says, accept the gift and love him. So I remember going home to my wife saying, honey, Cade came to the right place. We're going to help him reach his full potential. Let's go, hands in. Let's go. Are we in? And let's go. Come on. And it's a journey, but be positive. Look for the positive things in your child. If he crawls for the first time, just a little crawl, rejoice in that. If he sits up, takes some kids a while to sit up. You got to rejoice in the little things.
Well, we are rejoicing in the big experience of having you here to speak about all this. It's been a real gift for all of us, and what a wonderful example you and your wife are for the entire community and the entire country.
Thank you. We're having a blast. And you know what? We're really thankful we have a child with a disability.
We'll be right back. Fact or fiction? You can catch a sexually transmitted disease from a toilet seat.
To sit or not to sit, that is the question. This is fiction. You may choose to sit, but the chances of getting a sexually transmitted disease is nearly zero. STDs can only be contracted by direct sexual contact or blood transmission.
1 million Americans develop shingles each year, and now a vaccine is available. Today, the doctor is in, and Larry will explain whether this shingle vaccine is for you. Larry, exactly what are shingles?
Shingles is a real painful rash that occurs after the reactivation of the chickenpox virus. So when people get chickenpox and the rash goes away, it lies dormant in the nerve roots near your spine, and it can stay there forever. But in some people, when your immunity goes down with the aging process, it can be reactivated, or say you have some other type of infection or HIV, or you have some cancer or chemotherapy, that virus will travel along the nerve roots, along either your face, the neck, the thorax, even the legs, and come to the surface.
And the thorax is located where?
The upper chest here.
The upper chest area.
Yeah. And so it comes out, before you get the rash, it feels like a tingling or burning in the skin, or even a pain.
Ooh.
And then a few days later, you start to get these little blisters. And then the blisters become bigger, and then they eventually crust over. But the real problem with this is it can cause a really debilitating pain that can last for years. So if you can prevent it, it's very worthwhile.
Is the virus contagious itself? Can people give shingles to other people, or how does that work?
That's a good question. You can't give shingles to other people because you can give the chickenpox virus that is in the blisters, which causes the shingles. You can give that to somebody else who's never had chickenpox.
So people who haven't had chickenpox can get chickenpox from people who have shingles.
Exactly. But you can't give shingles to somebody who's already had chickenpox. The contagious period only occurs during the blistering period. Once those blisters crust over, then you're not contagious anymore.
You're not contagious.
Yeah.
Now, how long does this blistering period last?
Several days to a week, maybe 10 days. and it's painful during that time. And if you can treat it early, you can cut down the amount of pain that you have.
Now, when the blisters are gone and they've healed, you're saying that a person can still experience significant pain.
Oh yeah, that's the biggest problem with this, because you can get a severe debilitating pain. You can't sleep, you can't move. I mean, it's not like a minor problem, and you can be on a ton of analgesic pain medicines and still get the pain. So if you can prevent shingles, it's a very worthwhile thing to do, because it's so prevalent. Most people, by the time they hit 85, most people in the country will have had a bout of shingles.
Really?
Yeah, so that's how prevalent it is. So you want to try and prevent it, and we have ways to do that.
And what might those ways be?
those ways are two. One is you can make sure you get the chickenpox virus. If you never had chickenpox, get vaccinated for it so you won't get chickenpox. So if you never had chickenpox, and you won't get shingles. Or if you've had chickenpox, like most of us have, then you can get the shingles vaccine. And that's usually recommended for anybody who's over 60 years of age.
Well, this has really been interesting, and why don't we just leave the shingles on the roof and not on our bodies?
I agree with that.
Thank you so much for joining us.
We look forward to seeing you next time. I'm Dr. Larry Santora.
And I'm Heidi Cortese.
And remember, your health matters.
Be well.
These are some of the newer devices that have been recently either approved by the FDA or have really gained a lot of popularity in the recent years. I think here to our left here is a model of a disc replacement in the neck. Just as I alluded to, we do fusions in the neck commonly after a decompression procedure.